Ready to explore and reveal? Dive into today's question and uncover the answers together.
Persistent coughs can be caused by various factors such as asthma, allergies, gastroesophageal reflux disease, GERD, infections, or chronic bronchitis. It's important to identify the underlying cause. Treatment options include using antihistamines for allergies, inhalers for asthma, antacids for GERD, antibiotics for bacterial infections, and quitting smoking. If the cough persists for more than a few weeks, it's crucial to consult a healthcare provider for a tailored treatment plan.
Your daily dose of discovery ends here, but the journey of learning never stops. Subscribe and join us again for more answers tomorrow.